Is avocado good for joint pain in older adults? The joint pain secret hiding in plain sight. What if I told you that relief for your aching knees and stiff fingers might be sitting right in your fruit bowl? That creamy green fruit with the odd-looking pit could be more than just a trendy toast topping. It might be nature's answer to your joint pain struggles. Every day in my clinic, I see seniors wincing as they stand up, rubbing their knees with resignation as if to say, this is just part of getting older. But after 3 decades of working with patients over 60, I've discovered that what's on your plate might matter as much as what's in your medicine cabinet. I'm Dr. David Walker, a specialist in geriatric rheumatology, with over 30 years of experience helping seniors live fuller, healthier lives. I've dedicated my career to finding practical, accessible solutions for the pain that too often limits your independence and joy. Today, I'm going to reveal the surprising science behind how this humble superfood might be your joint's new best friend, and exactly how to harness its power for maximum relief, even on a fixed retirement budget. Nature's anti-inflammatory powerhouse. Have you ever noticed how some days your joints feel like they're made of rusty hinges, while other days bring unexpected relief? What if those good days could become your new normal? Inflammation sits at the heart of joint pain, especially for those of us over 60. Whether you're dealing with osteoarthritis, rheumatoid arthritis, or just age-related stiffness, the inflammatory process is what causes that familiar pain, swelling, and limited mobility. The secret to finding relief might lie in targeting this inflammation at its source, and that's where avocados come into the picture. Let me tell you about Margaret, a 73-year-old patient of mine from Chicago. When she first came to see me, she could barely make it up the 3 steps to her front porch without wincing in pain. Her knees had become her enemies, and she was beginning to feel like her independence was slipping away. I've tried everything, she told me. Pills, creams, even those copper bracelets my neighbor swears by. What made the difference for Margaret wasn't another prescription. It was a simple dietary change that included adding half an avocado to her daily routine. 6 weeks later, she returned to my office walking more easily than I'd ever seen. "Dr. Walker," she said with a smile, "I climbed those steps yesterday and didn't even think about my knees until I was already inside." The science behind Margaret's improvement is fascinating. Avocados contain special compounds called unsaponifiables. That's a fancy term for certain plant substances that remain after oils are processed. Specifically, avocado soybean unsaponifiables, ASU, have been shown in clinical studies to reduce inflammation and potentially slow the progression of joint damage. Think of these compounds as nature's peacekeepers, calming the inflammatory war happening in your joints. A 2025 review published in Frontiers in Veterinary Science confirmed that avocado, soybean unsaponifiables, ASU, greatly reduce the symptoms of osteoarthritis and demonstrate both analgesic, pain-relieving, and anti-inflammatory effects. In fact, these compounds work by inhibiting molecules that break down cartilage, the cushiony material that covers the ends of your bones. But that's just the beginning of the avocado story. Unlike most fruits, avocados are packed with vitamin E, a powerful antioxidant that helps neutralize free radicals that would otherwise damage joint tissue. Imagine these free radicals as tiny troublemakers in your joints. Vitamin E helps keep them in check. Avocados also contain lutein, a carotenoid that may help protect cartilage. You might have heard about lutein for eye health, but research suggests it has benefits for your joints too. The Arthritis Foundation notes that diets high in these compounds are linked to decreased risk of the joint damage seen in early OA. What's particularly exciting about avocados is that they don't just provide one beneficial compound, They deliver a complete package of nutrients that work together synergistically. In addition to vitamin E and lutein, avocados are rich in monounsaturated fatty acids that help reduce inflammation, potassium that may help counteract the negative effects of sodium on joint health, fiber that supports gut health, which is increasingly linked to inflammation levels, B. Vitamins that help your body manage stress, which can worsen joint pain, vitamin K that supports bone health essential for the structures surrounding your joints. Before you reach for that bottle of pain relievers again, consider this. What if adding one simple food to your diet could help you take fewer pills? What if that morning stiffness could improve without additional medications? I encourage you to think about one small change you could make to your breakfast or lunch routine tomorrow. Could you add some avocado to your plate? It's a simple step that might lead to surprising results. As we move on, I'll share exactly how much avocado you should eat for maximum benefit without going overboard, and the best ways to prepare it for optimal joint health. The answer might surprise you, especially when it comes to getting the most value from your grocery budget. The right dose. How much avocado makes a difference? When it comes to finding relief from joint pain, more isn't always better. So how much avocado should you actually eat to help your aching joints? You might be wondering, do I need to eat an entire avocado every day to feel the benefits? According to WebMD, the recommended serving size is 1/3 of a medium avocado. This modest portion delivers a powerful punch of nutrients without excessive calories or cost. Frank, an 82-year-old retired teacher from Boston, came to me complaining of stiffness in his hands that made it difficult to pursue his passion for woodworking. "These hands built my entire house in the 60s, he told me, examining his swollen knuckles with frustration. "Now I can barely hold a pencil some mornings." After discussing his options, Frank decided to incorporate 1/3 of an avocado into his daily breakfast mashed on whole grain toast with a sprinkle of lemon juice. Picture that vibrant green spread contrasting beautifully with the golden brown toast, the fresh citrus scent waking up your senses. "I was skeptical," he admitted during his follow-up appointment 3 months later. "But I've noticed I can grip my tools better, especially in the mornings when I used to be at my worst." For seniors on fixed incomes, I understand that avocados can sometimes seem pricey. Here are some budget-friendly strategies my patients use. Look for sales and stock up when prices drop. You can freeze ripe, mashed avocado in ice cube trays. Buy slightly firm avocados and let them ripen at home. They often cost less than ready-to-eat ones. Consider frozen avocado chunks as an economical alternative. Many grocery stores now carry these. Share with a neighbor or friend on avocado. Can easily provide 2 days' worth of servings for 2 people. Grow your own if you live in a suitable climate. Some of my patients in warmer regions have avocado trees that produce abundantly. What's happening in the body when you consume avocado regularly? The healthy monounsaturated fats in avocados help your body absorb other beneficial anti-inflammatory compounds and antioxidants from the foods you eat. These fats also support the body's natural production of collagen, which is essential for maintaining healthy cartilage in your joints. Clinical research supports what I've observed in my practice. Multiple controlled trials have evaluated avocado soybean unsaponifiables, ASU, for knee and hip osteoarthritis. The National Center for Biotechnology Information reports that these studies show ASU treatment can reduce pain and stiffness while improving joint function, allowing patients to decrease their dependence on analgesics, pain medications. Many of these studies used a daily dose equivalent to about 1/3 of an avocado, confirming that you don't need large amounts to see benefits. For seniors with limited hand strength who find cutting avocados challenging, here's a helpful tip. Choose avocados that yield slightly to gentle pressure. Too firm and they'll be difficult to cut. Too soft, and they may be overripe. You can also use a spoon to scoop out the flesh, rather than trying to slice it, which can be easier for those with arthritis in their hand. But here's something important to remember. Consistency matters more than quantity. Adding a small amount of avocado to your diet regularly will likely provide more benefit than occasionally eating large amounts. Elaine, a 68-year-old patient with rheumatoid arthritis, found this approach particularly helpful. I split one avocado across 3 days, she explained. A little on my salad at lunch, some in my smoothie the next morning, and the rest as guacamole with dinner. My joint pain hasn't disappeared completely, but I've noticed I can garden for longer periods without my hands cramping up. Did you know that the beneficial compounds in avocados can work synergistically with other anti-inflammatory foods? Consider combining your avocado with fatty fish rich in omega-3s, colorful berries full of antioxidants, or turmeric with its active component curcumin. This dietary approach creates a powerful anti-inflammatory effect greater than any single food alone. If you can't eat avocados due to allergies or simply don't enjoy their taste, don't worry. Other foods rich in healthy fats and anti-inflammatory compounds include olive oil, walnuts, flax seeds, and fatty fish like salmon. While these don't contain the specific ASU compounds found in avocados, they offer alternative pathways to reduce inflammation. I find many of my patients are surprised to learn that the timing of when you eat avocado might also matter. Your body's inflammatory response tends to be higher in the morning for many people with arthritis. Adding avocado to your breakfast might help manage this morning inflammation spike more effectively. Before we move on to how to prepare avocados for maximum benefit, I'd like you to consider this question. What's one way you could incorporate a small serving of avocado into your daily routine starting tomorrow? Even small dietary changes, when maintained consistently, can lead to significant improvements over time. From pit to plate, preparing avocados for maximum joint relief. Is there a right way to prepare avocados to maximize their joint-soothing benefits? As it turns out, how you prepare this remarkable fruit can make a significant difference in how it affects your inflammation levels. First, let's address what has become increasingly popular on social media: avocado pit remedies. Videos claiming that soaking avocado pits in alcohol creates a pain-relieving spray have gone viral. One TikTok user claimed, "Joint pain, neck pain, muscle pain, spasms. Spray it on there and thank me later." While these home remedies sound appealing, especially when you're in pain, we need to examine them carefully. But what does science say? While avocado pits do contain some bioactive compounds, there's insufficient clinical evidence supporting their external use for pain relief. The real benefits come from consuming the creamy green flesh of the avocado itself. This is where the research-backed anti-inflammatory compounds are concentrated. Barbara, a 71-year-old patient of mine with severe hip osteoarthritis, was initially disappointed by this news. "I was hoping for a quick fix," she admitted. "My daughter sent me one of those videos about soaking the pit in alcohol for pain relief." Instead, I suggested she focus on incorporating fresh avocado into her diet in ways that maximize nutrient absorption. After 2 months of regular consumption, Barbara reported modest but noticeable improvements. "It's not miraculous," she said, "but my morning stiffness doesn't last as long, and I can walk farther before needing to rest." For seniors who struggle with food preparation due to joint pain, here are some practical tips for handling avocados. Use a dish towel to hold the avocado securely while cutting. Try an avocado slicer tool, which many of my patients find easier to use than a knife. Purchase pre-cut avocado when hand strength is particularly limited. Mash avocado with a fork if slicing is difficult, perfect for toast or smoothies. Store unused portions with the pit and a sprinkle of lemon juice to prevent browning. Here's what research suggests about optimal avocado preparation for joint health. 1. Eat it raw. Heat can destroy some of the beneficial compounds in avocados. Raw consumption preserves the vitamin E, lutein, and other antioxidants that help fight joint inflammation. Imagine a perfectly ripe avocado flesh should be pale green, creamy, and buttery soft, not brown or stringy. 2. Pair with healthy fats. Combining avocado with olive oil, as in a homemade salad dressing, may enhance absorption of its fat-soluble antioxidants. Try drizzling extra virgin olive oil over avocado slices, then adding a pinch of turmeric for additional anti-inflammatory benefits. 3. Add a splash of citrus. The vitamin C in lemon or lime juice not only prevents browning, but also works synergistically with avocado's nutrients to boost anti-inflammatory effects. Picture squeezing fresh lemon over your avocado, the bright citrus aroma, mingling with the rich, buttery scent of the fruit. 4. Choose ripe, but not overripe. A perfectly ripe avocado yields slightly to gentle pressure. Overripe avocados can develop compounds that may actually contribute to inflammation rather than reduce it. The flesh should be a consistent green with no dark spots. 5. Incorporate whole avocado preparations. Research suggests that the beneficial compounds are present throughout the flesh, so varying how you eat it sliced, mashed, or blended can ensure you're getting the full spectrum of nutrients. For my patients with limited cooking abilities or energy, here's an extremely simple anti-inflammatory avocado preparation that requires minimal effort. Easy anti-inflammatory avocado bowl. Cut a ripe avocado in half and remove the pit. Leave the flesh in the skin. It makes a natural bowl. Drizzle with olive oil and lemon juice. Sprinkle with a pinch of turmeric and fresh ground pepper. Eat directly from the bowl with a spoon. For concentrated benefits, some of my patients have found success with commercially available avocado soybean unsaponifiable ASU supplements. These dietary supplements extract and concentrate the most beneficial compounds from avocados and soybeans. They're particularly useful for those who don't enjoy the taste of avocados but want the joint benefits. Clinical trials using 300 milligrams of ASU daily have shown significant improvements for osteoarthritis patients. The American College of Rheumatology and European League Against Rheumatism both recommend ASU for the treatment of OA symptoms. If you're considering supplements, look for products that specify the ASU content and discuss with your doctor first, as they can interact with certain medications. However, I always emphasize to my patients that whole foods offer benefits that isolated supplements can't match. The complete nutritional profile of avocados, including fiber, potassium, and various phytonutrients, works together to support not just joint health, but overall wellness. This holistic approach made a difference for Robert, a 79-year-old with both diabetes and arthritis. I was hesitant to add avocado to my diet because I was watching my calories, he told me. But when I replaced some processed foods with avocado, not only did my joint pain improve, but my blood sugar became more stable too. For seniors concerned about the fat content in avocados, it's important to understand that these are primarily heart-healthy monounsaturated fats, the kind that can actually help improve cholesterol levels when they replace saturated fats in your diet. The fiber in avocados also helps you feel full longer, which may aid in maintaining a healthy weight, crucial for reducing stress on painful joints. Are you ready to add avocados to your joint health regimen? Remember that while they offer promising benefits, avocados should complement, not replace, conventional medical care for arthritis and joint pain. Always consult your doctor before making significant dietary changes, especially if you have existing medical conditions or take medications regularly. In our final section, I'll address some important cautions about avocado consumption, potential interactions with medications, and share a simple avocado recipe that's specifically designed for maximum joint pain relief. I'll also explain how this approach fits into a comprehensive plan for healthy aging and pain management. Embracing a pain-free future, one avocado at a time. Throughout my 30-year career working with older adults, I've witnessed countless patients reclaim activities they thought were lost forever: gardening without pain, playing with grandchildren without limitation, dancing at family weddings when they once couldn't even walk comfortably. While avocados aren't a miracle cure, they represent something powerful: the ability to take an active role in your own healing journey. When Doris, an 85-year-old patient with severe knee osteoarthritis, first incorporated avocado into her diet, she had modest expectations. 6 months later, she was able to attend her granddaughter's graduation standing for the ceremony without the debilitating pain that would have previously confined her to a wheelchair. It wasn't just the avocados, she told me, tears in her eyes. It was realizing that I had some control over how I felt, that my choices mattered. This psychological shift from helplessness to empowerment is often as important as the physical improvements. Picture Doris standing proudly as her granddaughter received her diploma, the look of joy on her face worth far more than any pain medication could provide. Before making avocados a regular part of your routine, there are some important cautions to consider. Avocados may interact with certain medications, particularly blood thinners like warfarin, due to their vitamin K content. If you're taking anticoagulants or non-steroidal anti-inflammatory drugs, consult your doctor before significantly increasing your avocado consumption. Additionally, while rare, avocado allergies do exist. Start with small amounts if you've never eaten avocados before. Those with latex allergies should be particularly cautious, as there's a known cross-reactivity between latex and avocados. Watch for symptoms like itching around the mouth, swelling of the lips, or digestive discomfort. For those taking medications for high cholesterol, be aware that the compounds in avocados may affect how these drugs work in your body. This doesn't mean you can't enjoy avocados, just that you should discuss your dietary changes with your healthcare provider. Always consult your doctor before making health decisions, especially if you have existing medical conditions. The information I've shared today is meant to complement, not replace, professional medical advice tailored to your specific health situation. For most people, however, incorporating a moderate amount of avocado into a balanced diet offers a safe, natural way to support joint health and potentially reduce pain and inflammation, with benefits that extend well beyond your joints to heart health, blood sugar regulation, and more. I think about Samuel, a 91-year-old World War II veteran who came to me barely able to hold his beloved chess pieces. After 3 months of including avocado in his diet alongside his conventional treatments, he invited me to a chess match. Watching his fingers deftly move the pieces across the board, I was reminded of why I became a doctor: to help people like you continue doing what brings you joy. If you found this information helpful and want to learn more about natural approaches to managing joint pain, I invite you to subscribe to this channel. Each week, I share science-backed strategies to help you age not just longer, but better. Hit the subscribe button and the notification bell so you don't miss our upcoming video on the top 5 breakfast foods that fight inflammation. Have you tried avocados for joint pain, or do you have questions about other natural remedies? Share your experiences or questions in the comments below. Your insight might be exactly what another viewer needs to hear today. And if you know someone who's struggling with joint pain or arthritis, perhaps a spouse, sibling, or friend, please share this video with them. What seems like a simple piece of information to you could be the turning point in someone else's health journey. Remember, Aging doesn't have to mean accepting pain as inevitable. Small, consistent dietary changes like adding avocados to your meals can make a meaningful difference in how you feel and function every day. You deserve to enjoy these years with comfort, mobility, and joy, and I'm here to help you achieve exactly that. Like this video if you found it helpful. Subscribe for more science-based health advice for seniors, and I'll see you next week with more strategies to help you live your best life after 60.